Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 55, 60 minutes or so discussing one of the programs that we feel is a must-have in your portfolio if you operate in North Texas. And so what we're looking to do today is speak to and invite our friends over at Care NCare to visit with us about details of their programs for 2022. And we think that you'll find this of great value if you operate in this space. One of the things I want to remind you of is this presentation is being recorded and it will be posted to our website at premiersmi.com and on our YouTube channel as well. Those folks who have expressed interest in today's webinar will be receiving some follow-up information as well, so watch for that, please, if you would. You'll notice in the software package there's a section for questions and there's a section for chat. We ask that you use the questions section. We find in many circumstances we answer those inquiries throughout the course of the presentation, but we want to make certain that we get you the information you need to totally utilize the opportunity you have with Care NCare here in North Texas. One thing that we'll do as well is do a little bit of level set as to who Premier is. We're a national marketing organization that was founded in 1968. That's part of the Integrity Marketing Platform. We have offices across the country, and we act as an insurance wholesaler working with independent insurance agents and agencies such as yourself to deliver care to the population we serve. We do so through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. We work through a full portfolio of product, specializing in the senior space, the Medicare space. I want to put it that way because there's a whole bunch of people on Medicare that aren't seniors. But the Medicare programs that we offer are Medicare Advantage and Medicare Supplement plans, the standalone Part D prescription drug programs, but also a full portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and those ancillary benefits, the dental, vision, hearing, critical illness, cancer, hospital indemnity, accident, and even a telehealth program that help deliver the care that your book of business, your current clients, and those that you are looking to add to your book are looking for. That Medicare Advantage portfolio is a robust selection. The national carriers are there for you, in addition to the strong regional carriers that we speak to and that we invite to visit with us here today. The prescription drug programs, they follow that same mentality where the national carriers are there for you through our organization. And you'll find in many circumstances these contracts are part of the MA programs contracting as well. Medicare supplements, large selection, a lot of programs in place to help you succeed in this space. We find it very important that we look at the entire spectrum of the Medicare population and make certain that we have programs to address their needs across the choices that they have, because it includes ancillary products with the national carriers in each of these categories. But it's important because it's a huge opportunity. If you look at the numbers of folks that are eligible for Medicare based on age, it's nearly an exponential growth. And we hear of the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 people plus a day. That's all well and good, but we got to keep in mind that life has changed, particularly affected in the last couple of years, where a lot of folks, if they're eligible for Medicare, doesn't mean they access it immediately. So the number's tempered a little bit, but then restored by the fact that 15% of the Medicare population is under the age of 65 and are in need of our assistance as well. And that's particularly pertinent when we speak to the Medicare Advantage programs, because the benefits are not age specific. So if you're on Medicare disabled at age 12, you're going to get the same benefit package that you would at age 82. So we want to make certain that we cover all of the folks that are part of the Medicare population, because they got challenges. 2/3 of them have 3+ chronic conditions. Many of them have challenges with their income and assets, and we want to make certain that we cover them because it's a huge market of need. These folks need our help. In many circumstances, the folks that we speak to, particularly in the Medicare Advantage arena, they don't have anything other than original Medicare as it is, because, hey, they got choices. When they come on Medicare, they don't even have to take Part B. They can decline it should they choose to do so. Thankfully, many don't. The vast majority don't. Some will self-insure for the medical portion of it, and pick up that standalone Part D to help with prescription drug expenses. Some will access the standardized, modernized Medicare supplements and handle those medical expenses that way and then pick up a Part D plan. Or there are a number of folks that are, well, they're basically fans of the TV series that speaks to bundling, and that's Medicare Advantage programs, where it's an all-in-one package that includes not only the medical portion and the prescription drugs, but many extras that you'll see in the programs. What choice is appropriate? Well, that depends upon the person that we're speaking with and what we do with them. But what we're seeing statistically as people come into Medicare, should it be an age-in, late to Medicare seniors, we're seeing a pretty even split between Medicare Advantage and Med Sup plans. We're seeing a growth in this percentage with Medicare Advantage because of some of the extra benefits and other economic pieces that come into play. But we look also to the folks that say, well, we're still in original Medicare. Keep in mind, that includes people that are dual beneficiaries. They might have Medicare and Medicaid. It will include the folks that are accessing care at VA. It'll include folks that may have a retirement program from where they worked or where they were associated with in the past. And then we have those folks that, in the words of an old sales manager I had at Prudential longer ago than I care to admit, the decision to make a decision is a decision. Some of them consciously said, I'm not taking any other coverage. Some just didn't. And now we have a spectrum that we need to address in that fashion. And in order to do so, we want to make certain that we are communicating properly. So part of what you'll get as part of the follow-up is a link to this acronym guide, making certain that the insurance industry, with our own language that we have, we got AEP, SEP, OEP, MOUSE, all these different acronyms that come into play. This will help you make certain that we're communicating properly. And it's also a reminder for us as agents to stay away from some of the acronyms unless we explain them as we go along. We don't want to confuse people. We want to help them be conscious of what they have available and what it means to them. Because you'll see through different presentations that we have from Kaiser Family Foundation, the majority of folks aren't examining their options annually. And we need to make certain that we can influence that number because, hey, if they don't, it can become very expensive for them. The choice in the past may not be the best choice in the future. And those that are most in need of this advice, they're having challenges getting that information, assimilating it, digesting it, and saying, hey, what's my best choice? And it's really important that we use the skills that we have as independent insurance agents to make certain that they have the information and that they can help understand the options that they have, because they're not even using what the government puts out there. The Medicare.gov site with the plan finder, well, there was an announcement earlier this year. They're tweaking it again this year. The last couple of years has been a bit of a challenge. So we want to make certain that even if a person is accessing this information, which we see a whole bunch aren't, we have other tools that can help deliver the information too. Because, hey, everybody gets a Medicare new book if they're on Medicare. In October, it either comes by snail mail or a whole bunch of people are getting it electronically now, but they're not really reading it. You're seeing a great amount of electronic information available, an app that they can download to see what is covered by Medicare. A whole bunch aren't using it. And then this is a really strong illustration of the fact that our communication skills is paramount to the well-being of the folks that we discuss options with, in the fact that, hey, this video has been out since April of 2015. There are about 63 million people on Medicare. In that time period, 8 years, 7 years, less than 1 million people have looked at it. And this, in all honesty, it's a really cool little video. They're not accessing the information they need. So we need to be able to deliver it either in person or by a means that they feel more comfortable with virtually. And we're seeing, because of the pandemic, how this has been influenced. And so having a partner that has the technology to do some things remotely and deliver upon that information through whatever means is necessary, and we'll talk about that later in the presentation, we need to make certain they have the info in order to digest things because they've been trained on it. You'll notice over the last couple of years, I went to a doctor for 9 times during the pandemic, didn't see him in person once. And when I finally got to see him in person, it was a different type of situation where we, excuse me, we were trained to assimilate the information that are delivered to us by our doctors, by our specialists. Hospitals are using it, dentists are using it. Hey, faith-based organizations are using that delivery system to deliver things electronically. So the population is much more savvy than they have been in the past. And we then want to make certain that we're able to deliver upon the details on programs such as our guests today with Care NCare. If you work the North Texas market, this information can be a crucial portion of your success moving forward for the rest of this year, most assuredly, because programs are available, but then also in 2022. So we've invited our friends from Care NCare, Mr. Steve Plocek, who's recently assumed the reins of Medicare sales for Care NCare in North Texas. We wanted to highlight Trish too, because Ms. Cloud can be a crucial part of your success on a face-to-face basis. Steve is our presenter today, and so what we're going to do is turn control over to Mr. Plocek and welcome him into our presentation. Steve, thanks for coming on. You should be, there you go. You've got your presentation up.
Sweet, good deal. Thank you so much, John, and thank you all for your attendance today. I appreciate your time. I value your time. I thank you very much for the time you're giving me today. Hopefully we'll be able to even get you out of here a little bit earlier. But as John said, I have assumed a new role. I'm very excited about what Care NCare is about in the market and what their offerings are. But let's go ahead and get started. So let me move a couple of these little boxes around over here so I can see my screen. So who is Care NCare? We're a local plan. Been here about 13 years, sitting in 13 different counties. Be heads up on those highlighted counties that I show you there. All right, there's those 5 highlighted counties, and there's more to come on that. Kind of wetting your whistle there, let you know there's going to be some more information that we'll talk about those 5 counties here shortly. But that local plan, we're not in all 254 counties in the great state of Texas. We're sitting in 13 counties in that situation. Wait a minute, not 13, excuse me. We are in, 13 counties. Let me check 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 11, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yep, 13 counties. I thought it was 13 counties. But we're in those 13 counties in the market. So, I mean, we're here, we're bringing that local flair to you guys, right? And I think that's what you need to understand. You guys, for the most part, are local in this North Texas area. We have local physicians. You're serving basically a local market. Our ownership is local. So that's what I'm really trying to leverage basically when I point out what Care NCare is and who Care NCare is. So let's talk a little bit about our parent company, Southwest Health Resources. So a couple of years ago, we see that basically 2 of the largest hospital networks in North Texas, UT Southwestern and THR, merge. They come together. They form an organization by the name of Southwest Health Resources. That's huge. That's our parents. To have basically, huge hospital groups, very dominant, strong hospital groups, own a Medicare Advantage plan. You're seeing more and more of this in a roundabout way with some of our other national carriers, or in some of their markets are very, very heavily based as far as really being able to leverage their networks, where that we also see other areas where it's straight up hospital, and they also have a Medicare Advantage plan. This isn't something new at all, but you're seeing that trend increase. You're seeing more and more of that partnership between physicians, between insurance, come together so that they have that complete package. And that's certainly where Southwest Health Resources is, and the way that Care NCare fits in to that family. But all in all, let's kind of keep going here. Let's talk about a little bit more about that Southwest Health Resources. So many of y'all have heard of UT Southwestern, very, very well known in the region and even in the nation, specifically what it is. And then, Texas Health Resources. I mean, this is also an organization that's growing phenomenally by leaps and bounds. I mean, you look here on my map over here, and you see what's open and you see what's coming. Nearly as much as what's open is what's coming. So, I mean, they're doubling in size. That growth is huge. One of the other things I wanted to point out here is currently we sit approximately about a dozen urgent needed cares. This next year, we bumped that number up to 36. 36 urgent needed care is basically in the area. So again, small plan, we're growing. We're growing in the right direction. And I think that's what you need to basically be, you need to have in your mind. And it's certainly what I have in my mind is this is definitely an option for you when you're out there. And we're constantly looking for that right person, right product, right time, right? We want that right fit for that individual based on what their needs are, based on that value needs selling. We hear that a lot. Well, that's specifically what I'm certainly all about. And I think our plans show that too. Oh, wrong way. Sorry about that. So local, can't say enough about it. You have local individuals here. I live here locally. I've been here a good chunk of my life. My boys were born here. We have local, basically customer experience team. They're local. They sit here. They're not going to tell you if you're sitting in Benbrook, you got a member, client that's sitting in Benbrook. Oh, well, just go run over to this doctor. We got a great doctor over here in Rockwall. Okay. That's halfway across the Metroplex. I don't know how long that would take most people. Even it would take me a decent amount of time, and I can kind of drive a little aggressive sometimes. But at the end of the day, you have individuals that understand where you're at, where your clients are at. And I think that's huge. And I think you need to remember that when you hear or you think of what Care NCare is. What is it there for me? What is it there for my customers and my clients? All right, so let's talk about some plans. Let's talk about some HMOs. So let's kind of focus on that orange at first right now. Okay, let's not get into my green. I get excited about my green here, but let's talk about this orange. Y'all know the classic plan. This has been one of the first plans that Care NCare ever came out with. You see where we're at in 2021. Check out where we're at in 2022. Differences that you see, a little more aggressive on that specialist copay, dropping down to 20 bucks, all right? So dropping 5. At the same time, you see our inpatient hospitalization pops up about 25 bucks on day 1 and day 2 through 6. 100 to 125 day 2 through 6, and that day 1 is going from 250 to 275. Moving on down the line, figured out where we need to be basically as far as where the market's at. I'm very happy to say that basically you see a $90 copayment for emergency room. We see that basically your outpatient, your ambulatory and outpatient did hop up a little bit from 21 to 2022. So let's talk about that green over there. You got to, what's that? I want to know about that. That's right, $2,900 MOOP. Okay, this plan is that what we call our Southwestern Health Select Plan. Now we talked about those 5 counties at the beginning of the presentation. Those were Dallas, Tarrant, Denton, Collin, and Rockwall. One more time: Dallas, Tarrant, Denton, Collin, and Rockwall, 5 counties. Well, then you see that where my HMO sits in all of our counties, this select plan, this Southwestern Health Select Plan is only going to be offered in those 5 counties. Okay, that's the catch. $2,900 MOOP. You see it, $10 specialist co-payment. Very, very aggressive going down the line there. You see day 2 through 5 at 75 bucks. Again, very, very aggressive plan. Again, that catch is got to make sure you understand where you're at as far as geographics go. Okay, let's go ahead and go to this next slide. Maybe. There we go. So again, let's focus on our classic plan first. Very stable. Plan is pretty same old when we get into these areas. We do see a little bit different. I have a slide dedicated, so we'll talk a little bit more about dental and that dental rider. But I do want you to know on that HMO plan, it's sat at 20 and it's moving to 25. $5 up on my HMO plans. Again, we'll talk a little bit more about that. That same option benefit is most certainly offered on that select plan, but you're seeing equal in these 2 plans right now, from the classic to the select. You got that OTC, you got the dental, you have the value-based added benefits such as vision and hearing. Same on each plan, making it easier for you guys. All right, let's talk a little bit about RX, talk about some medications, some drugs. You see a little bit of change, basically $2 increase on those tier 2, $5 on your tier 3. Again, these are 30-day supplies I'm quoting you right now. And you see a little bit of movement there also on those 90-day supplies also through the mail. If you come and check that out on the opposite side or on that green side with that Southwestern, you see again, very, very aggressive, very, very aggressive. And I cannot leave this slide without talking about those those insulins, those puffers, those COPD puffers, that coverage through the gap. All right. Those tier 1, you have partial coverage basically on those medications for select tier 2 and even tier 3. So you have a very aggressive drug plan, and I think that's key. And you know, I can go look at stats. Stats are great. I like talking to agents. When you talk to agents, agents are going to tell you the number one reason somebody's either going to make a change or what they're most concerned is their medications. I'd say between medications and network, they're pretty doggone tight, right? But we know that drugs at the end of the day are very, very important to our clients, to our members in these scenarios. And I think you can see what Care NCare is doing here. They're being very aggressive here. They get it, they understand it. And I can't tell you, I certainly appreciate that, to be able to bring a strong offering, not only to the community, but to the agents that basically represent this plan in the community. So let's talk a little bit about PPO plans. All right. So if we look at 2 of our PPOs, we have a total of 4 PPOs, and now we have 2 HMOs, talking about 2022. So we're going to talk about our first 2 PPOs. And if we look at inpatient care on our choice plan, that's our 0 premium HMO plan. You see here at the top, you see a little bit of movement here. You see a little bit of movement on that day 2 through 6, $25 bump there. All right. Otherwise, this is same old, no change, a lot of stability. I like that. I don't like people having to go run around and redo things they did last year or the year before. I like to have as much consistency as possible. That's not the easiest thing to be done, but at the end of the day, I do see a lot of consistencies between the offerings that we have from 21 to 22. We look over at that PPO plan, that plus, that Choice Plus plan, you do have a $55 premium on it. What's the difference there? We see the drop basically. We see a little bit more aggressiveness, that $3,500. You see your co-payments basically a little bit lower, even that scenario, specifically around that specialist. Obviously, in network is always a lot less expensive. All right. So all in all, again, stability there. Let's move on next slide. So again, don't see a whole lot of movement from 21 to 22. Nice and consistent. Now, we talked HMO, we talked $25. It went from 20 bucks to 25 on that HMO. On our PPOs, it's 20 to 26. That dental rider, again, I have a slide dedicated to that here shortly. We'll talk about that more. But you have a dental rider on your PPO plans, all 4 of them. You'll see that consistency of $26 premium on that plan. That's a monthly rider, okay? But otherwise, you still see the vision and you still see the hearing, very consistent year over year. We have 2 more PPOs that I want to touch on. Oh, not quite. Let's talk about some drugs. A little more aggressive, basically, on that choice plan. We see those drop just a little bit. We look at tier 4 on that plus. We see that moved up by $5. Just want to be very transparent. I want to be right up front with you, the way that I would expect you to be with the community, with your clients out there in the field. Now let's hop over to that next slide, or those 2 next PPOs. So we have our last 2 PPOs. Our first PPO that I want to talk about is this premium PPO, $200. Everybody kind of freaks out at that. You look at a Medicare Advantage plan and you think 0. The industry has done a great job of that. I was a part of that. John and I had sold basically in those days when we sold 0 premium plans back in the day. We scoffed basically at somebody with a premium. But you got to look at it. You got to see what's going on here. This is not a dual plan. We do not have any special needs offerings at Care NCare. All right. This is a straight up Medicare, A and B, live in the county, right? But you look at, if you stay in network, 0, 0, 0 all the way down. You normally see those kind of co-payments at a dual plan, a dual SNP plan, a plan for people that are on Medicare, Medicaid. But this premium plan, I think you want to take a look at that. I got a slide. I want to talk a little bit about more of that in the presentation here shortly. And then we have an MA only plan. Again, it's a PPO plan. We see the aggressiveness. You see an aggressiveness basically is something dropping 50%. That's pretty huge. $50 day 1 through 6. I like that. I think that's pretty neat to me that you see that aggressiveness out there. This is a great plan for those individuals that maybe are working with the VA, or maybe double check it, make sure you're good. Some of your retirees out there, this could be a really good fit for them. Be careful with that though. Pay attention to where you put that MA only plan, because as soon as you put a person on that MA, You could cancel basically a drug plan. So you really want to pay attention. You want to talk to their administrators or whoever you can at their former company, whoever they retired from, right? So all in all, let's keep moving down the line here. We see a lot of consistency here, same over year over year. Again, we see that 26 PPOs, 26 for my rider in 2022. It's 25 on that HMO again. All right, but again, you see basically that same, not a lot of change. Easy for you guys, easy for your clients that you already have on these plans. Let's talk a little bit about some drugs. Remember, now my MA only plan is not going to have drugs, all right? But my premium plan does have medications. Pretty aggressive down the line if you're looking here. Do see a little bit of movement on those tier 4. They did hop up, 30-day supply hopped up $5, obviously $10. Buy 2 months, get 1 month free on that 90-day mail order. All right, let's keep moving through here. So let's specifically talk a little bit about that premium plan, right? Let's talk about that 200-hour plan. Who would be the right person for that type of plan? So let's check out my slide here. Currently on a med sub due to medical issues, interested in maybe checking out a different plan, but they're unable to pass any kind of underwriting, move to a different med sub, right? They need some more aggressiveness. We can start looking at people ballpark mid-70s, maybe even as early as 72, and they're probably spending, good chances they're sitting there spending basically $200 a month. Oh yeah, plus you got a drug plan, right? Maybe even have a deductible even on that drug plan. But remember, that $200, that's wrapping it all together. I like to call it the happy meal, bringing it all together. You got it all there. You got your drugs, you got your medical, you got your hospital, one card convenience. Oh yeah, you got a gym program, on and on with all those value-added benefits, right? So I think that's important that we think of those individuals. Maybe we find some of these individuals, such as the third bullet down here. Hey, these folks basically, they're already seeing UT Southwestern, and they're also in scenarios that they're dealing with this COPD, or they're dealing with, diabetes and insulins that they have. That Saver program, it's huge for these individuals, again, plus those value-added benefits. So don't scoff at basically that $200. Oh no, I just want to deal with the zero. I just want to leave that individual there. Tell you what, the people that figure out how to be unique, how to leverage a unique plan in the market, those people will win. Those people will succeed. They will help their community and they will help themselves. I'm totally about both of those things for sure. All right. So slide talking about some of our vendors that we work with. True Hearing is the vendor we work with regarding our hearing benefit. iMed for vision, DentaQuest for our dental. We also work with Mom's Meals, becoming more and more an industry standard that we see out there. After an individual is, in the hospital, they're released, they have X amount of Mom's Meals, of meals that are delivered to their home. Silver Sneakers, great partner of ours, really started the whole industry regarding, physical fitness and benefits with the Medicare Advantage plans out there. One thing I also did want to highlight on the slide that happened kind of mid 2021 was that telehealth. That is a zero copayment for telehealth. Mr. Dubas mentioned 9 visits without actually seeing an individual. I think that trend is with just Mr. Dubas. We're seeing a lot more of that through all across different age groups, different types of insurance. But as long as you use MedLive, basically that's a zero charge visit with that physician. That dental. So we talked about it, 25 on the HMO, 26 on the PPO. It was $20, so it's up $5 on the HMO monthly premium, up $6 on the PPO monthly premium. But check this out. So in 2021, you had $3,000 maximum benefit a year. More than doubled that, I was doing an event just like this. It wasn't virtual, it wasn't WebEx, it was a face-to-face event. And a young lady, agent, licensed, appointed, certified, raised her hand, and she was all giddy. Can we just sell just the dental plan? Can you just get us just a dental plan like that? No, I can't. You can't do that. It's all part of the whole deal. Don't represent it as just a dental plan. Represent it as a Medicare Advantage plan with one of its value-added benefits of, oh yeah, dental. We do hear a whole lot. I mentioned earlier about network. I mentioned earlier about, the interest in the RX benefits that these Medicare Advantage plans have by the general public, right? Well, dental is probably your number one value-added benefit out there that we talk to. Individuals are very, very interested in that. across all spectrums. I mean, your dual folks are very interested in that. Your folks that are on Medicare, Medicaid, and the folks that aren't on Medicare and Medicaid, just on Medicare, very, very interested in it. Implants, no deductibles, no waiting period. You have basically that full amount of money, that coverage basically as of your effective date on your plan, not waiting in a quarterly situation or something like that. Very excited about our dental plan for 2022. So what sets us apart? I'm constantly looking at ways that I can make myself unique. What am I going to do that's different? All right. We have all kind of different plans out there. There's all kind of different agents out there, right? How do you differentiate yourself as an agent? What are you doing different than one of the other folks on this call or somebody else out there in an appointment or other folks that are part of the agency that you affiliate, that you work with? So I'm constantly looking for what is that USP? What is that unique selling point? And these are some of the points that basically I've been able to uncover here with Care NCare. This tier one. Tier ones will have gap coverage on all their MAPD plans, all right? So on all the MAPD plans, we got that coverage. We're being unique. Not all plans have that. You're seeing a trend and more plans are doing that, but it most certainly is something that is unique to Care NCare, I feel, for sure. Part D selected COPD inhalers and your insulins include that gap coverage on all of our plans. That's huge. I see basically some of our more national plans, as Mr. Dubas spoke about earlier, really leaning into that type of a benefit, looking to cover medications through. We certainly hear that. We've heard it many a time. I know myself, I've heard it several times. You got any gap coverage? Do you have anything to cover the donut hole? Well, no, I don't. But you see what plans are doing out there. Plans are being designed in that situation to do what they can to cover that gap or lessen that gap that we see out there. And you also, don't be afraid to go out there and check it. Yeah, we talked about the changes. John mentioned that at the top of the call, right? About what Medicare.gov and that plan finder and the drug basically finder, where it shows. You definitely will see at the top of that list, especially if you're working with individuals that are out there with basically diabetes or COPD, you will certainly see, not just Steve talking about it. Yeah, I want to sell Care NCare, but let's look at what our industry standard is. They're basically pulling Care NCare to the top of that list because of the benefits that we are offering in this North Texas market. So more support for you. We really hadn't been working with anything in the past, any of these quoting tools. These are all going to be in play for 2022, not 2021. I know we're still hustling and we're still selling for those 11 and 12 ones, but as of 2022, Care NCare will definitely be found, and we are working very close to finalize everything with Connexure, CSG Actuarial, and Sunfire. So just wanted to say, hey, we're moving in that right trajectory. We're doing more as much as we can to be able to support our agents out there that are supporting us within the community. So getting ready to wrap this up, but what's next? Now, I know we're in a virtual situation now, but I do want to let you know that I'm going to have a general, not a specific to one agency or another, but on Thursday, September 30th, 11 to 2, you certainly can see an instant replay of this presentation. I will give this presentation maybe even more than once. I haven't decided. I don't know if agents can deal with more than one of me in a day, but all in all, I will certainly offer this presentation of going through our rollout. But the big thing that I want to basically be able to do between 11 and 2 o'clock on the 30th of September, Thursday coming up here at the end of the week over in Las Colinas, is I want to basically hand out sales kits. Now in the past, Care NCare has constantly or has always been one to send out sales kits. We're going to be still doing that. If you are appointed, if you are certified for 2022, you will receive basically what we call our kit. That will consist of several different flyers, some benefits at a glance, 5 PPO and 5 HMO sales kits. Now, you want some more. You want to be able to stock up. You want to come over and meet myself. You want to come over and meet Miss Trish Cloud, maybe Tom Ty out in the field, maybe some of the support of Care NCare. You got a question for us or what have you. Get yourself up to Las Colinas between 11 and 2 o'clock on September 30th, that Thursday, right? Come on up there, pick up a couple more sales kits, get ready to have a rock and roll AEP, and we're here to support you. I'd love to be able to shake your hand. I'd love to be able to meet you. I can't tell you the most important thing to this organization And this is what I bring to the table because John, as we talked before, repping or selling back in the day, is we're agents. I understand how important our distribution channel is and how important agents are and how tough the job is of being an agent. And I want to do everything I can to support you. I want to make it easy. I want to give you a least line of resistance in that scenario. I want to give you access to me. I want to give you access to my team. And I definitely want to make sure that you have the materials you need to set up and have a very, very successful AEP. And with that, I want to wrap up basically my presentation. I can't thank you enough for basically the time that you've given me today. I'm very, very excited to have the relationship I have with not only Premier, but Mr. John Dubas. John and I go back many, many years, and I feel very, very, I'm very appreciative to be able to partner with an individual such as Mr. Dubas, and most certainly with Premier. John, I'd like to pass it back over to you at this time, and I thank you for your time, guys.
Awesome. I took my picture off the screen because we wanted to focus on you and the program that you have. And I appreciate it, Steve. I think our audience will recognize the passion that you have, not only for the programs that you offer through Care NCare associated with Southwestern Health Resources, but importantly for our agents, which are our customers, and the ultimate consumer, which is the Medicare beneficiary, that we have to be a huge advocate to the care and the benefits that are delivered to them. It's very important for us to do that. So let me see if I can't fix my screen here really quickly. And pardon me, folks, you'll notice that we have changed something on today's webinar that we haven't done in the past very often, and that's letting you see just who's chatting with you. So the webcams is something that popped up on the screen and kind of hid some of the things that we have. But I think through the course of Steve's presentation, you see a marriage of a lot of the deliverables that we have to you as an agent. And what I'd like to wrap up with is just a few quick slides as to why you'd want to do this program, Care NCare, a premier program in North Texas, no pun intended. Why us? Well, some of the things that we can do is we can help you contract electronically. The situation to get involved with Care NCare is a direct link that we will provide for you. The contracting process is electronic. But for folks that are looking for some of those other, as Steve mentioned, fill in the gap type of products, creating an agent profile Insurance Bay enables you to answer a lot of the questions that you see common in contracting with carriers. And it's a place for you to store your errors and admissions, go through all the different things that are necessary in the contracting process so you can pick up a hospital indemnity plan or a dental program in addition to the programs that Steve mentioned. Because keep in mind, sometimes we run across folks that have a need for dental coverage, and the coverage may not be enough by one program. A lot of the standalone dentals are paying in and without any other type of interaction with other coverages, so they can be very helpful for you. So utilizing this electronic process can really speed that up for you and make certain that if you are a person like me who has handwriting that needs to be translated by some kind of Banty rooster, well, you don't need to worry about that if we're doing it electronically. We do offer discounted errors and admissions coverage for qualified agents. What makes you a qualified agent? You got a contract with us. So this is not adding you to a blanket E&O policy for one program. This is a coverage that you own and satisfies the requirement. And we see across the board in the insurance industry where we want to protect ourselves with our version of malpractice insurance, errors and admissions through this program. Great way to make certain that you protect your financial liability. We do also offer discounted discounted continuing education programs through our association with WebCE. Great way to make certain that you keep your license in place. And you can actually add to your own benefits through a modified guarantee issued DI program, disability income. I made a big deal about using acronyms earlier in the presentation, but this is a program you can do to enhance your own benefit package as an independent agent and be paid a commission on it. Much as where today's presentation is being recorded, past presentations have been recorded as well. They are featured on our website in the educational portion of it. And so you'll see things with carriers, but you'll also see things conceptually with types of insurance programs, different type of marketing programs that are out there to make certain that not only do you have the great benefits to offer folks, you also have a way of getting in front of the folks that need your help. So grassroots marketing campaigns, working with faith-based organizations, dealing with providers, all those sorts of programs that are pretty much common if you're going to own your target market. Those hints and tips are available to you 24/7 through a recorded process. Steve mentioned that Care NCare is being very aggressive in their approach of making certain that they can deliver the electronic needs that you need to deliver the message and to enroll people. And what you saw as a listing of the engines that he mentioned, they're all part of our Medicare Center. They're all available through an all-in-one universal login from any device. It not only puts you in touch with these programs powered by Connexure, Sunfire, and CSG, and you'll see some really good advancements in that. But we've also added to the CRM that's part of this program, available to you without cost, and there's resources guides in there to help you as well for different hints and tips on different parts of what we do in our market. First and foremost, we speak to compliance all the time as well. I know Steve is a huge proponent of making certain, as he mentioned, right product, right person, right time, but also delivering it in the right way. And so making certain that we have that scope of appointment so we can discuss the different possibilities that folks have. And because the generic scopes have a multitude of products listed on it, as long as they're health programs, mark them all. Talk about cross-selling or set up future selling possibilities, and you can use this system to help you track and take care of them. It's available without cost to our contracted agents. It's really got a cool tool in it that gives you a fill in the gap feature that Steve kind of alluded to, in the fact that many of the Medicare Advantage programs have that hospital copay. This has a fill in the gap feature where you can pick Care NCare as your base Medicare Advantage program, see the hospital out-of-pocket expenditures, and fill in the gap with a hospital indemnity program. Because you did service the program properly and you put that on the scope of appointment, we're talking about all kinds of things, you can do this compliantly and take care of it. Keep in mind, there are some things that you can't do on a health insurance appointment. You know, you can't talk about life insurance during that, long-term care, short-term care, those sorts of things. But there are programs that you can utilize within this system to maximize the value of your appointment. And don't discount the commissions on those, because if you see some of the renewal business that you have in the Medicare Advantage space, sometimes the commissions with these programs are nearly as much, and they're paid as issued. Keep in mind, during AEP, we don't get paid on that business until after the first of the year. We want to make certain that you take care of all the monies that are coming to you. Hence, another portion of our website that puts all the carrier incentives on there. Now, when we talk about Medicare Advantage or PDP programs, max comp for that set by the government each year. Most of the carriers, that's what they offer. They offer you the max that they can pay you on those systems. There are, however, other programs that you may have in your portfolio, those ancillary programs, Medicare supplement plans, which you got to keep in mind is appropriate for certain people. And then some of that applies to carrier trips and premier incentive programs as well. We want to make certain that you're aware of all of the compensation that's available to you. So exploring our website can be pretty helpful in that regard, because that can turn into cash for you. That happened for agents who qualified for the premier programs last year, but the crews got kind of cashed in. The pandemic kind of dictated what we can and can't do. So some folks came out with some pretty significant dollars in their pockets. We also want to make certain that we're able to put you in front of folks to visit about the programs that are available. We do have contact lists butted up against Do Not Call that can be custom ordered for you. They're available at low or no cost. Keep in mind, once again, we can't cold call for MA or PDP programs, but what we're seeing is a lot of folks build their own T65 program by marketing dental programs to people 63 and a half or 64-year-olds, because at 65, there's a rate increase. And so it's a great way to build your funnel of prospects by working through some things, and it's a different approach. I worked with a lady who turned 65 by 10 o'clock in the morning one time. She got 21 calls from agents offering her their assistance to work on Medicare supplement plans. It's a different approach. You're different. So yeah, it's the small bell relationship, but it can be very profitable for you. I mentioned too, we had recordings on different pieces of community-based marketing programs, but this goes into detail about the retail marketing plans that are or opportunities that are out there. Some carriers offer specific stuff. Everybody thinks of Walmart. If you're in North Texas and you're working in the key counties with Care NCare, you got to be aware of what you can do in Walmart. And so this is a viable piece for you. And a lot of times too, people will respond to outreach through their faith-based family where they won't through television ads, radio ads, direct mail, calls, whatever it happens to be. That trusted source of working with faith-based organizations. We have programs that can help you ingrain yourself into the community and take advantage of that, because those folks need your help. They're not responding. They're part of that 57% that say annual review. No, nope. Provider marketing, big deal. One of the things that I really appreciate about Steve and his background is the fact that in the past he's done a bunch of different things with providers. Now, when you look at providers, that goes beyond the doctors. That's an obvious one. Specialists, maybe hospitals. Look at the other folks that deliver care, dentists. You got a product here with Care NCare that isn't dental network specific, but they're using dentists, and you can go out and visit with them and grow your book that way. It is an area that is not as heavily marketed as some of the other centers of influence in the community. So we have programs in place that can help you walk that path. Some carriers do generate prospects as well and share with them, particularly during the annual election period. And for some carriers, if they're offering DSNP or other turn-in SEP opportunities, great way to utilize the assets of a huge organization. Now, Steve's organization does that as well, but keep in mind, this has to be a symbiotic relationship. So you've got to be able to go into a situation and say, hey, I'm your partner. I'm working with you. This is what I'm bringing to you. Can you help me? Because that walking out with the handout bit doesn't work too terribly well. We do have internet lead and direct mail support as well, and a neat program to help you maximize the leads you get from any source through utilizing a referral program. And in all honesty, the biggest challenge with referrals is asking. So not politically correct anymore, but I love Pepe Le Pew. He's always chasing Penelope. He wants to get kissed. How do you get kissed? You got to ask. We have some different things that can help you walk through a referral solicitation program without being Herb Tarlick in the plaid coat saying, hey, you want to buy a watch. That lead program for mailers, we have two of them. One for health benefits and one for final expense. So you can qualify for two each month, but it deeply discounts the cost of direct mail and is available through different vetted preferred lead vendors. We do that in order to make certain that we protect you on the back end. Because if you have one in the old days, back when we were repping, Steve, called a sales training incident, an STI, we want to be able to verify where that lead source comes from and that the solicitation of that lead was compliant. These folks all have a CRM, so you get the immediate access to response. They're all really strong when it comes to customer service, and they're all experienced as to what kind of campaign you need to deliver now. Keep in mind, it is a little over a week in September. If you're mailing for AEP and you want it to hit as AEP, you got to do it now. We're running out of time because you got about a 3-week turnaround on some of this stuff where you got to get the campaign out, the responses need to go, and then they get back to you. It is not an immediate response. It's not microwave like some of the other pieces that we offer, but it is a campaign you can control. So you know what's going out, you know what they are responding to, and you know how to visit with them. We do also have 2 different programs, though, that work just on mail response. Flipping back and forth here, that's not your vision, or you haven't had too much soda this morning. It is a program that deals with the folks that have responded to direct mail. You purchase those responses instead of controlling the entire mail campaign. Had very good success with these programs, and folks will use them as a main marketing thrust. In other areas, they'll use them to augment different pieces where, boy, I'm on a little bit of a valley. I don't have as many leads right now. I've gone through a whole bunch of stuff. Great way to fill in some of the gaps too. Good responses, never been touched. The opportunity is there for you, and it's a great way to get into it, particularly if your budget at one point in time is a little more limited. We do offer internet leads through Facebook, a program for final expense and for Medicare. Uh, we see that the demographics on the different pieces of social media for the folks that we want to address, well, it's predominantly Facebook or YouTube. So it's a great way to get into a kind of a really quick response on this as well. The challenge that we see with a lot of the internet lead programs, however, is they're responding quickly. They're expecting you to do the same. If you don't, well, keep in mind, they clicked on you. They may be clicking on a couple of other folks too. It may look like an exclusive lead. It will be through this program, but they may have accessed advice from other organizations through other lead sources too. So we want to make certain that we do it. And one of the things that we find, we talked about the referral program or follow through that you can do with a sales process. It's awful important if you're using Medicare Center in the past, you've got your book of business in there. Engage those folks that are your clients, asking for their help for folks that you may need or may need your services. So you're maximizing the value of whatever lead comes in by simply asking for more. It's the old, may I have some more, please? We're going to talk old literature there, but a great way to make certain that we're getting you in front of as many people as possible. We do all this simply because, hey, we want your business. We want an opportunity to work with you. We feel that the shared opportunity that we have with Care NCare is very strong in North Texas, and we want to be able to be your partner in pursuing that business. And so we ask you to add Care NCare as part of your personal marketing plan. It's the old expression from John Wayne and the Cowboys, that great movie where he says, hey, slap a piece of bacon in that biscuit, saddle up, let's ride, because we're burning daylight. And that's what we're doing here. We're at the point in time where we need to contract, we need to certify, we need to know our products, we need to integrate Care NCare into our marketing plan moving forward in North Texas. And the time to do it, it's now. So all that said and done, I'm going to check for questions really quickly to make certain that we covered what came up. There's a couple Steve took care of during the course of his presentation. Stephen Boney mentioned, and pardon me if I mispronounced your name, sir, that in some states plans for underage Medicare recipients are limited, which is actually really true, but it depends upon the type of program. So Care NCare in North Texas is not age specific. Personally, the youngest person I've enrolled into a Medicare Advantage plan, and this goes back a little ways, was a 2-year-old, medically disabled. The oldest person was 102. Down in Fair Park, no less, Steve, living by herself and legally blind. So you don't have to worry about the ages with this program in North Texas. You'll see in Texas, however, with Medicare supplement plans, if someone's under the age of 65, medically disabled, different animal. They don't have access to all the plan types that people over the age of 65 have. That, I think, is the extent of the questions. I want to thank you for coming on the line with us today. I want to thank Steve for his help in the presentation today. We look forward to doing some things regularly to make certain that you are, as an agent, aware of what Care NCare offers, not just now, not just into AEP, but throughout the year. We also want to make certain that we thank you for the time you've invested with us. It's your most valuable asset. We realize that. Thank you for that. For those of you that have done business with us in the past, there's another thank you. For those of you that are about to do business with you, we thank you for that too. Thank you so very much. So watch for some follow-up that will come to you through email. I try to do a lot of things now with links to keep some of the things from going in the spam filters, or I did a bunch of attachments in the past. Sometimes it works, sometimes it doesn't. So watch for that. It'll come to you as the updated recording link comes into play. But you can reach out to us, 1-800-365-8208 is the toll-free number. If you work with a marketer within our organization, they're going to help you with Care NCare. If you haven't worked with us, we're going to assign you to a subject matter expert that can help you engage this program, make certain that Care NCare is a strong part of the portfolio that you offer. You can visit us as well on our website at premiersmi.com. There's one of those lovely jot forms that you can fill out and say, hey, need some info, talk to me. Somebody will reach out to you really quickly. All that said and done, until we have that opportunity to visit with you once again, thank you. We appreciate your partnership. Steve, we thank you for your presentation and our partnership. I highly value our relationship, as Steve said, going back longer ago than either one of us care to admit, back when we were repping, taking care of the Metroplex in our own way. We appreciate everyone involved in today's project. So all that said and done, until we're able to chat with you again, we're going to wish you good selling. Thanks so very much, and we'll talk to you very, very soon. Thank you, Steve.
Thanks, John.